Conversations with patients sometimes goes like this. Hey doc, since I removed the back tooth, I don't need to replace it, right? Welcome back. I'm your girl, the Niger dentist. And if you're new on this page, welcome. On this page, we talk about oral health tips and we give oral health education. So make sure you join this oral health family by tapping on that subscribe button and turning on your bell notification so you can get an alert whenever I upload a new video. Alright, stick around and I will see you in this video. A subscriber of mine who also happens to be one of my mentors left a comment on one of my YouTube videos and told me to explain the importance of replacing a missing tooth. A patient is more likely to replace a tooth if it's in the front, but oftentimes when it's the back tooth, you hear things like it's at the back, nobody's going to see it, and then they don't see the need to replace it. So I'm here to tell you today that that's not the case. There are actually things going on in the mouth that are quite harmful to you that you probably won't take note of until it's too late. When a back tooth is lost and it's not replaced with either a denture, an implant, or a bridge, what happens is what we call supra eruption. The opposite tooth on the opposite arch actually grows into the space of that missing tooth. The reason is because nature doesn't like void. So because there is that space and there is nothing supporting the tooth on the opposite arch, it actually grows like it grows all the way down. And what would happen over time is that tooth would lose its bone structure and you can end up losing that tooth as well. And aside that, the tooth can actually grow into the gum and be impinging on your gum and actually causing harm. Like it would hurt your gum. Aside the supra eruption, the teeth that are on the opposite sides as well, or on the adjacent side now, so to say, they tilt into the position. Like I said, nature doesn't like void whatsoever. So they tilt into that position just to fill the space. So therefore, your basic functions like mastication, even speech, can sometimes be affected. And over time, there would be pain from that tooth and it will lead to periodontal problems. What I mean by this is the teeth can start shaking. Aside removing just one tooth, you might end up losing the ones at the side as well. So when you lose a single tooth and then you don't replace it, there is a probability that you would end up losing at least 3 more teeth. And if you lose at least 3 more teeth, more and more would follow. You know, I'm a big believer of quality of life. And if you lose a tooth and you don't replace it, and everything I have mentioned actually happens, and then you end up losing all your teeth, your quality of life would reduce. And aside that, over time, if this process keeps going on, you might end up being edentulous, which means you might end up losing almost all your teeth. Most patients are always afraid of the financial implication of replacing a missing tooth. So I am going to further explain the options that are available to each patient, even if you are on a limited budget.
The most affordable option for replacing a missing teeth is the removable denture. Denture can either be full, like in this picture, or replacing a partial part of the teeth, like in this picture. So it depends on the number of teeth missing that determines the type of denture to be given. And in some cases, the denture might actually be held in place by an implant. This is way more expensive than the previous one I showed. A fixed option of tooth replacement is the bridge, as seen in this picture. A bridge carries a crown and is usually cemented to the teeth or an implant, and then that holds it in place and there is no need for removal. It is way more expensive than the simple denture we see. Also, the third option we have is the implant. This is the most expensive of them all. It is important that you speak to your dentist to determine what the appropriate option is for you, and this will be determined based on what your financial situation is and the state of your oral health.
So I got the inspiration to do this video while I was on a shoot. You can check out the pictures on my Instagram page. So if you're one of those people who have actually lost a tooth and did not replace it, and there has been supra eruption and tilting of the teeth that are adjacent or opposite, there is a solution to that problem. What can be done is to give braces to correct the tilting, and if the supra eruption is not very severe, the teeth or tooth can actually be trimmed down, and then there'll be a replacement and everything would be fine. But if the supra eruption is so marked that nothing can be done, it might actually be that you would have to lose the supra erupted tooth, which then you would now replace the supra erupted tooth and the tooth that was previously extracted. But then it's better to do that and everything should be fine than to end up losing way many teeth. Guys, we only get one chance at this teeth business. Thank you for watching this video this far. If you have enjoyed this video, make sure you give this video a thumbs up, share with family and friends. I will really appreciate that. And till I see you in my next video, make sure you put a smile on somebody's face. Bye.